Good afternoon, everyone. Come take the journey within. That is the slogan for our registered charity, The Journeyman. Our charity was registered in July last year. On paper, we fall into the advanced health category. In reality, we are so much more. One of our board members always liked to say that The Journeyman is a mix between a hobby group, a social group, a health and well-being, and a collection of community projects. Currently, we have over 450 members, and even though we were only founded last year, we're still rapidly growing. So why are we here and what do we do? Well, our number one goal is to combat Australia's mental health crisis. Now that is a strong statement. You see, some are in denial that Australia even has a mental health crisis. Those who do know simply just don't understand the scale and severity of it. In 2021, 19% of Australians were diagnosed with a mental health disorder, anxiety and depression being the most common. Just a decade before, it was half of that. To see an increase like that in just a decade is alarming. And those are the people who are diagnosed. God only knows how many are undiagnosed. And according to research from the Black Dog Institute, only 50% of those suffering from a mental health disorder get help for it. And for anyone still in denial, suicide is the leading cause of death for people between the ages of 15 and 44. And now, I'm 19, and to think I got a higher chance of killing myself than dying in a car crash is a demoralizing feeling. So what is causing this mental health crisis? Well, there are multiple factors. Our organization has identified two issues that have compounded over the years to really push us to crisis point. And those are loneliness and social isolation. Social contact has been on the decline for the past 2 decades. This includes things as simple as talking to a cashier or calling an old friend. In 2022, 25% of men between the ages of 15 and 24 were socially isolated. And for guys between the ages of 35 and 45, it's 21%. So contrary to popular belief, it's not just the youth who are lonely. Now, you may wonder, sure, is loneliness a problem? Is it that bad? I mean, really honest question. Is loneliness that bad? At the end of the day, loneliness is an individual problem. It's something in your head. As bad as it is, loneliness does not have any physical effects or societal implications, right? Well, turns out it does. Loneliness causes serious health and societal issues. In fact, the World Health Organization has designated loneliness a public health concern. According to research conducted in 2010, with a study involving over 300,000 people, they found that loneliness and social isolation are as bad for your health as smoking 15 cigarettes a day. I know it may sound hard to believe, but it's been correlated with other studies. Research also shows that social isolation increases your risk of death by 26%, the chance of developing dementia by 50%. And generally having poor social relationships was associated with a 29% increased risk of having a heart disease and a 32% risk of a stroke. Take in these numbers for a second, everyone. This is the challenge our organization is facing. This is the challenge we are all facing. So how do we rise to this challenge? Destigmatization, awareness, education, and action. There is a stigma around loneliness. Research conducted by Dr. Lim found that around 1/3 of people say they feel really ashamed when they feel lonely. The Silver Line, a telephone help service, reported that 70% of those accessing their helpline said they do not want to burden others. That is why our charity is a free support network. We charge no membership fee. We do subsidized activities for those who can't afford it. We run a free conscious gym program. We do hikes and walks because after all, physical exercise has been proven to be one of the best things you can do for your mental health. We have free social catch-ups from camping to just a simple cookout. Now for those that are really struggling, that are too anxious to even come to the activities, we have a one-on-one service where we try and build their confidence so we can integrate them into the group. We try to get our members to be more active in the community through our subsidized volunteering program. I can personally say that volunteering and doing something for your community really does give you a sense of purpose. But the problem is, volunteering numbers have been in decline for over a decade. And a major reason is because people just can't afford the fuel or food or equipment to volunteer. That is why our group covers our volunteers' expenses. So, catch-ups, gym, advocacy, and other programs. Why do we do these things? Because like any good doctor will tell you, prevention is better than cure. Only 50% of people suffering from a mental health disorder seek help for it. And those who do look for help often only get it when it's too late. That is why we have to stop loneliness before it becomes depression. And before depression becomes a downward spiral that leads to the unthinkable. So that's why organizations like ours are the first responders against the growing mental health crisis. Stop loneliness and social isolation before it leads to something far worse. That's why our group, if all else fails, acts as a referral system. Since most people don't get help, either because of the stigma or a lack of referral, key members from our organization will refer those in need to the appropriate service. Sometimes that's all people need to get help. Some non-judgmental advice from a caring friend. Now, I'd like to thank you all for your time. I am Luke Gardelli, Project Manager of the Journeyman. I would now like to introduce our founder and director to the stage to tell you how it all started. Let's welcome William McIntyre.